to the panelists. In both cases, many today from their studies, and the embargo will be lifted officially for all of these studies at this moment. And he is the HPTN 083 Protocol Chair, a professor of medicine in the Division of Infectious Disease at the David Geffen School of Medicine at the University of California, Los Angeles, and co-director of the UCLA Center for Clinical AIDS Research and Education. He will now discuss data from the HPTN 083 study on long-acting injectable cabotegravir for HIV pre-exposure prophylaxis or PrEP. Rafi, please go ahead.
Thank you, Monica. Be able to discuss these HPTN FTC to prevent HIV infections in diverse transmission contexts and populations. Its public health impact has not delivered uniform benefits to all populations. Those disproportionately affected by HIV are the same populations that have not found equal access, uptake, adherence, and persistence to oral tablet-based pre-exposure prophylaxis. The goal of HPTN 083 was to establish the preventive efficacy of long-acting injectable cabotegravir in cisgender men and transgender women who have sex with men globally. Cabotegravir, just to briefly review, is a novel integrase strand transfer inhibitor chemically similar to dolutegravir that is formulated both as a short-acting oral tablet for injection. Cabotegravir is being simultaneously developed for treatment of people living with HIV and active cabotegravir, initially oral for approximately participants who chose or needed for safety reasons to stop their injections before 3 years were given 48 weeks of open-label TDF FTC after their final injection and then be terminated. The results being made public. Portion of the study, we'd enrolled 4,570 participants. Participants who were found to have acquired HIV prior to administration of any study products, and participants who did not come in for any follow-up visits were excluded from the primary efficacy cohort that I'll be reporting on. The study population was very diverse by intention, 239 incident HIV infections for an incidence rate of 1.22%. The hazard ratio between the two arms was 0.34. That's 66% fewer HIV infections in the participants receiving cabotegravir compared to those receiving TDF FTC. The 95% confidence interval on that hazard ratio, provocative findings and exciting results. Our conclusions are that both products reduced HIV incidence compared to the expected background incidence rate dramatically. Cabotegravir was superior to TDF FTC in this population, with 66% fewer infections of HIV occurring in participants randomized to CAB compared to TDF FTC. Both were generally well tolerated, despite high rates of injection site reactions in the CAB arm. Having the drug concentrations and resistance data in those who acquired HIV will be really critical to a full understanding of the relative advantages of each PrEP regimen. It's tremendously exciting to have data that will hopefully support regulatory approvals of an additional PrEP agent to increase choices for HIV prevention. And we eagerly await the results of our sister study, HPTN 084, being conducted in cisgender women in sub-Saharan Africa and companion adolescent bridging studies. I'll stop there. Thank you.
From the abstract. Exciting. So our next speaker will be Ricardo Diaz of Federal University of Sao Paulo. He will share a report on what may be the first adult with HIV to achieve at least 57 weeks of long-term HIV remission without a bone marrow transplant. So Ricardo, please go ahead.
MSM Brazilian Caucasian male. He's been on regular antiretrovirals for 2 years. Then he was recruited in our study and randomized to receive on the top of the antiretroviral treatment, dolutegravir, marabirol, and nicotinamide for 48 weeks. We knew that marabirol was a latent reversal agent, and also we described that nicotinamide has that property of being a latent reversal agent, besides boosting the immune system. So he's been for 48 weeks in this scheme, and he had, during the study, a decline in cell activation, the inflammation, and a very deep decline in the antibody titers. He had 2 viral blips during the study, and we were monitoring viral loads every 4 weeks. And he had the DNA present in PBMCs and retinal biopsy by the end of the study, as well as during the study. Then he returned to the regular art scheme right before the 40 weeks and stayed being treated like that for almost 3 years. Then he was again invited to proceed with the analytical treatment interruption. And interestingly, right, the DNA, the HIV DNA, PBMCs were completely negative. Then he's now been for 64.7 weeks, the last time that we shall not be doing any further intervention. And during the ATI, the analytical treatment interruption, is still with a decline of the antibodies.
Ribociclib is widely used around the world and is now first-line therapy in the WHO treatment guidelines. So, Rebecca, please go ahead.
Thank you, Matt, from the SAPAMO study. SAPAMO is a large birth outcome study funded by NICHD, and it started in 2014. It collects data at the time of delivery throughout Botswana to look for differences in adverse birth outcomes, including birth defects, by maternal HIV status and the ART regimen taken during pregnancy. In May 2018, SAPAMO first reported neural tube defects with exposure to dolutegravir at conception. And at that time, we had found 4 neural tube defects among 426 women taking DTG at conception, a prevalence of almost 1 neural tube defect per 100 births, which was way higher than the expected prevalence of 1 neural tube defect per 1,000 births, and also significantly higher than all the other comparator groups, which included women on other maintaining gender equity in HIV treatment outcomes really requires pregnancy safety data. This is an important lesson, not just
as it goes down and down this incident. So our next speaker is Simiso Sukelo of the University of Witwatersrand in Johannesburg, South Africa. And she will share results from the ADVANCE study, which is a phase 3 randomized trial in South Africa comparing
led clinical trial that was set in South Africa, comparing dolutegravir and 2 formulations of TDF with the standard of care. South Africa has a background in NRTI resistance estimated to be about 5 to 15%. And we started ADVANCE with that information, and patients were randomized into 3 arms, and they were being followed up to week 96. So I'm presenting 96. No more FT.
San Francisco, and she will discuss interim results from the SURGE PrEP study, one of the largest studies ever conducted in East Africa, which looks at the impact of PrEP on HIV incidence in 16 rural communities in Kenya and Uganda. Catherine, please go ahead.
Universal access to PrEP as being at risk of HIV. We provided same-day PrEP, and then we provided a flexible care delivery model with follow-up visits at clinics,